Thank you for joining us today for Medicare 101. My name is Chris Winterroad. I'm the SHIP and SMP Program Manager. I was a teacher before I started working for the state, and so you'll probably go, oh yes, as we go through this presentation, because I'm very teacherly. I also love field trips. That was my favorite part of teaching. So we're going to take some field trips today to some of the websites and important resources that we're going to talk about, and leave the slides every once in a while just for fun. Today in this Medicare 101 workshop, we're going to talk about the important consumer assistance programs, SHIP and SMP. I'm going to give you some Medicare updates for 2023. There are several things that have changed this year. We're going to go over all of the alphabet soup parts of Medicare, A, B, C, and D. We're going to talk about the Medicare enrollment periods, Medicare options, and the implications for how you get your health care depending on what you choose. I have some COVID updates and then some other just sort of more general resources. So as I mentioned, I'm the SHIP and SMP Program Manager. SHIP stands for the State Health Insurance Assistance Program. We're contracted by the Centers for Medicare and Medicaid to provide free, unbiased, expert information and assistance for people on Medicare. If you're paying any attention at all, holy cow, as soon as you get near 65 or become eligible for Medicare, you start getting a ton of information, things in the mail, emails, unsolicited phone calls. They just come out of the woodwork. And sometimes it's really hard to know what information to trust. And that's really what we're here for. We provide counseling, education, outreach. We work with people who are on or starting soon with Medicare, but also family members and caregivers. Our sister program is the New Mexico SMP, which stands for Senior Medicare Patrol. And again, related to all of that deluge of information people get mixed in with all of that is a lot of stuff that you should not trust. And our Senior Medicare Patrol is the part of our organization that's tasked with healthcare fraud, education, and prevention to help Medicare and Medicaid beneficiaries avoid, detect, and prevent healthcare fraud. This helps preserve the integrity of the Medicare and Medicaid programs so that they're in place for further generations. And it also helps people learn how to protect their personal identity, identify and report errors on their healthcare bills, and identify deceptive healthcare practices, such as illegal marketing, which is a huge issue. Companies that try to take advantage of you by providing unnecessary or inappropriate services and charging for services that were never provided. These are all problems that we see on the regular. So we're going to take our first little field trip now. And I'm going to give you just a brief glimpse of our Aging and Long-Term Services Department website. If you're in this workshop, you've probably seen that already. But I'm going to show you some things that you may not have found when you visited on your own. So let me just share my new screen here. Okay, let's see. Sure, I'm sharing the right one. There we go. So this is our Aging and Long-Term Services Department website. We provide a lot of services way beyond the Medicare and Medicaid information that you're here for today. You can find out about other events by going across the top to news and events and clicking on upcoming events. You'll see what we have going. We're adding new things all the time. You can see that Senior Olympics Track and Field Sports Clinic is coming up in Albuquerque in March. The next Medicare 101 is on March 22nd, and we have new things being posted up here all the time. You can find out about the capital outlay priorities for the Aging and Long-Term Services Department. The Medicaid waiver is a benefit that helps pay for in-home caregiving services. So if that is something that is important for you or one of your family members, this is the place to start. This is the place where you can report online to Adult Protective Services, abuse, neglect, and exploitation. We have an amazing app that we provide for free to New Mexico residents that allows you to learn about reverse mortgages in a no pressure situation. We're not selling reverse mortgages, but that's an incredibly powerful financial tool that many people avoid because it's scary and they're worried about fraud. So we provide the access to the Economics app right here that will allow you to just learn the facts and how a reverse mortgage might work for you in a zero pressure environment. And you can see we've got a lot of different things. If you want to know what's happening at your local senior centers, you can look under meals and nutrition. You'll find where your local senior center is, other senior services. And down here at the very bottom, I want to show you right now, the best way to get to any of our videos is by clicking on the YouTube icon that's right here above the C in ACL. It looks like a little VCR play button. And if you click on that, it takes you directly to our Aging and Long-Term Services Department YouTube channel. And you can see we've got the Medicare Minute for January. We post a new Medicare Minute every month with updates. Here's one from last fall to help people prepare for Medicare open enrollment, which you're going to learn more about. Oops, sorry, we don't want to actually start playing the video. And as you can see, there's a lot of other information here from other Aging and Long-Term Service Department divisions, as well as information about SHIP and SMP and Medicare. You can find just the information that we put out by going to playlists, right? And here's the SHIP and SMP playlist. Here's a Medicare playlist. There's lots of information available, and we are trying to make it a little bit easier to find than that. So we're going to go back to our regularly scheduled program now. And you should be seeing the presentation again. So what is Medicare? Medicare is health insurance for adults who are 65 or older, younger adults with certain disabilities, and anyone with end-stage renal disease. If you have end-stage renal disease, you will receive Medicare immediately. When you turn 65, you qualify for Medicare if you collect or qualify to collect Social Security or railroad retirement benefits. You may also qualify if you are a U.S. resident and a citizen or a permanent resident who has been in the United States for 5 years in a row. Yeah, permanent residents are eligible, but they have to have been here for 5 years continuously. If you're not yet 65, you qualify for Social Security if you're receiving Social Security disability or railroad disability annuity checks for 24 months. If you have ALS, there's no waiting period, and you start receiving Medicare as soon as you go on SSDI, and it's the same for end-stage renal. So what are the enrollment periods under these circumstances? If you are receiving a Social Security check, if you've already signed up to start getting your retirement from Social Security, then you'll be enrolled automatically in Medicare Part A and B. If you're not, if you've opted, if you're still working, or you've opted to wait until your Social Security benefits maximize, then you're going to need to actively enroll online at ssa.gov. The enrollment period starts 3 months before the month you turn 65, includes the month of your birthday, and extends for 3 months after the month of your birthday. So it's a 7-month initial enrollment period, which is exactly what the next slide says. If for some reason you miss your initial enrollment period, you can also enroll during the general enrollment period, which runs January 1st through March 31st every year. And this is one of the new changes for 2023. Coverage begins the month after the month that you enroll, if you enroll during the general enrollment period. You may also qualify for special enrollment periods if you have a number of different circumstances. You're moving, your employer coverage ends, or you're entering or leaving a long-term care facility are a couple of the most common ones. We're going to take another quick little field trip here to show you the Social Security website. Let me just, I'm going to do a new share. Sorry, my control bar is right in the way. Okay, so we are going to go to the Social Security website. You should be seeing the Social Security website. I want to point out to you right up here at the top, you know you're in the right place if you see the US flag and a statement that says an official website of the United States government. There are so many scams and people looking to take advantage of you out there. You do not want to Google anything about Medicare. Instead, go directly to the correct website. And for Social Security, it's www.ssa.gov. And you can see, if you haven't already been here, if you haven't already created an account, I highly recommend that you do so. But you can go right here, right on the landing page is the button to click for signing up for Medicare. It's that easy. I highly recommend that if you need to actively enroll in Medicare, that you just do it through the website. It's by far the quickest, easiest, and most reliable way to do so. You can do many things from here. You can explore your eligibility for benefits, plan for retirement. It'll, if you create an account, you can go in there and it'll make a nice little chart for you that shows you when your retirement amount is going to maximize, and then you can make a decision about when you want to start receiving that based on what's going to happen with your payout month by month, year by year. You can get your benefit verification letter, get tax forms, you can replace your card from here. There's all kinds of stuff. This is a great website. So let's go back to our regularly scheduled programming again. Okay. Do you have any questions before we move on to the parts of Medicare? Let me open the chat just in case. Felicia says that she created a My SSA account a while ago, even though she's not even close to retirement yet, just to make sure that everything was there the way it should be and to get some ideas about when she could think about retiring. I think that's great. Okay. So I have some hot off the press updates from Medicare. They sent these out to us in January. There's been some big changes for 2023. So one of them I mentioned earlier is that the date that your Medicare becomes effective, if you enroll during the general enrollment period, has there used to be a gap. There used to be a 6-month gap, and now your Medicare will become effective the month after you enroll, which is really great for people. There are also technical changes to the calculation for the Medicare late enrollment penalties. I have not received the training on that yet. Generally speaking, it is 10% per year. So it'll be interesting to see how that changes. It's really by far the best to enroll during your initial enrollment period. That way you don't have to worry about penalties, but some people end up with those. If you need help with that, we are here for you. We can help you figure out what that's going to be and to see if there are any ways that you might be able to avoid the penalties. So you may also qualify for a special enrollment period with no late enrollment penalties. And we're going to go over what those exceptional conditions are right now. If your authorized representative, a legal guardian, or caregiver was impacted by a disaster or emergency and you were unable to enroll in time, then you will qualify for a special enrollment period. That starts the day that the federal, state, or local government declares the emergency or disaster and goes for 6 months. 6 months after the end of the disaster declaration. Okay. Your coverage will start if you enroll during during that particular special enrollment period, the month after your enrollment is submitted. Other special enrollment periods can happen when your health plan or employer makes an error. They've given you bad information. I've worked with people whose employer told them that they could continue to carry their retiree insurance once they're Medicare eligible, which is not true. And so if you've found yourself missing the enrollment period due to bad information, then you're going to get a special enrollment period. Formerly incarcerated people also have a special enrollment period. Special enrollment period starts the day the individual is released from incarceration and lasts for a year. You have a year to get enrolled in Medicare. If your Medicaid coverage ends, your special enrollment period will begin the day that you're notified that Medicaid coverage is ending and goes for 6 months. This is especially important as we really move into the post-pandemic environment because many Medicaid programs were extended through the pandemic and people may have missed their enrollment period because they still had their Medicaid. So this is an important one for us, especially right now. And there may be other exceptional conditions that allow you a special enrollment period. Check with us, let us know what your circumstances are, and we will help you figure that out. You can always reach the SHIP and SMP programs by calling 1-800-432-2080. Okay, now you are enrolled, whether you were enrolled automatically because you're collecting your Social Security retirement already, or you went on and actively enrolled yourself on ssa.gov, you will get a card in the mail that looks like this. It's the red, white, and blue Medicare card. It does not have your Social Security number on it. If you know someone who is still using a Medicare card that has their Social Security number on it, please make sure they know that they need to request or find their new card. Social Security in 2019 sent everyone the new card that has a randomly generated alphanumeric ID. That's to protect your personal information. Now, you can refuse it, and the instructions are on the back of the card. I'm going to give you lots of reasons to check with us before you do that, because you don't want to find yourself in an underinsured situation for sure. Once you've received your Medicare card, then you can think about filling out your Medicare coverage with either a prescription drug plan and a Medicare supplement or a Medicare Advantage plan. But before you can enroll in any of the other coverage that you need to really be covered fully, you have to have your Medicare card and your Medicare ID. So if you haven't yet enrolled in Medicare, that is a top priority, because it's going to hold up your other coverage until you get that Medicare ID. So what do you need besides that red, white, and blue Medicare card with Part A and Part B? There's basically two ways to get your Medicare coverage. You can have what we call original Medicare, which is where you have your Part A hospital coverage and your Part B doctor coverage that you're getting directly from Medicare. There's no third parties involved. You add a Part D prescription drug plan, and then you may or may not choose to add a Medigap policy. With this type of coverage, Medicare pays 80% and you're responsible for 20%. That's where the Medigaps come in. The Medigaps cover your 20% of the covered benefits under the policy that you choose. The great thing about original Medicare is that you can go to any doctor that you choose, any doctor that accepts Medicare, you can go to. You don't have to worry about prior authorizations or referrals. If the doctor takes Medicare and you want to go to them, you can. The downside is that it does not include any dental, vision, or hearing coverage. And that makes a lot of people turn to considering the Medicare Advantage plans. The Medicare Advantage plans are also known as Part C, and they bundle together your Part A hospital coverage, your Part B doctor coverage, and your Part D prescription drug plan, so that you're getting all of those parts of your healthcare coverage through a plan that's offered through a third-party insurance company. They're usually here in New Mexico. They're almost always an HMO or a PPO, and they're going to be very familiar to most people because they work pretty much the same way most employer plans do, right? So this is going to be your Blue Cross, Humana, United Healthcare, Presbyterian plan. If you enroll in a Medicare Advantage plan, you do have to get your health care within that plan's network. There's a big difference, and we'll talk about it in a little bit, but between HMOs and PPOs. HMOs tend to have smaller, more local networks, and they only pay if you get your health care from an authorized provider within the network. If you join a PPO, they tend to have more extensive networks, and they also cover both in and out of network providers. You're going to pay a higher copay if you go to an out of network provider, but you can get your care out of network. An important thing to know about a Medicare Advantage plan is that if you join a Medicare Advantage plan, you cannot also get a supplement. Medigap, the Medigap is also known as a supplement, and those terms are used interchangeably. So it's one or the other. You can only enroll in a Medigap policy if you have original Medicare and get your hospital and doctor coverage directly from Medicare. If you join a Medicare Advantage plan, you cannot also enroll in a Medigap. In terms of costs, there's a trade-off. With original Medicare, you're going to have higher monthly premiums. You're going to have the monthly premium for Part B. You're going to have your Part D prescription drug plan premium, and you're going to have the premium for your Medigap policy. And my kind of rule of thumb for estimating when you're trying to do your cost benefit analysis, whether, how much your insurance is going to cost if you choose original Medicare with a supplement, is to double your Part B premium. It may cost a little bit less than that. It's unlikely to cost very much more than that. That gives you a ballpark idea of how much it's going to cost. The flip side of those higher monthly premiums is that when you go to the doctor, you're not going to have any out-of-pocket costs because your Medigap policy is going to pay the 20% that's your part under original Medicare. So there's always a trade-off. If you enroll in a Medicare Advantage plan, you're going to have your Part B monthly premium. Then you're going to have whatever the premium is for your Medicare Advantage plan, and it's all over the map. There's a wide variety of premiums and plans available in New Mexico. So you're going to have a lower monthly premium burden, but every time you go and get any service, you are going to have a copay. So, and those can add up. So it's really a pay in advance situation if you enroll in original Medicare with a Medigap, or more of a kind of a pay as you go situation if you enroll in a Medicare Advantage plan. Do you have any questions about the difference between original Medicare and Medicare Advantage coverage before we move on to the next bit? I'm not seeing anything in the chat, so we will just move along. I want to take just a quick field trip here. Again, to the Medicare website. This is the only place that I recommend people go to look for Medicare information about Medicare. Again, as I mentioned earlier, if you Google anything about Medicare, you're going to be inundated with a gazillion websites that all want you to click into them. If you go to a website and it asks for any information from you, even your name, before it will give you the information you're looking for, you're going to want to get out of that right away, because that is, they're phishing. They're phishing and trying to get you your information. You're much better off going directly to Medicare.gov. And again, right up here in the upper left-hand corner, you see the flag, and it says an official website of the United States government. That's how you know that you're in the right place. So from here, you can create an account. And if you're going to be on Medicare, I highly recommend that you do that. You can get all of the information that you need about your care, about your bills. Everything is going to be right here. You can explore health and drug plans that are available. You can find care providers, and you can find resources and talk to somebody. Of course, I'm going to recommend that you call us if you have questions at 1-800-432-2080. And here's my favorite part. If you're new to Medicare, you can just click on the Get Started with Medicare button, and it's going to take you right here. You can go in and you can find all of the same information that I'm providing in this workshop in a different format. You can find out about the parts of Medicare, the general costs, how Medicare works, what if you're still working past 65, how to sign up, all the information about that, how the coverage works. And then once you start on Medicare, there's some great information about how to use it, right? So I really highly recommend bookmarking this, going back and taking a look. it can be really helpful to have information presented in more than one way, right? To be able to go back. This video of this workshop will be available, but some people really like to be able to just read about it. And you can go on here and you can just go directly to whatever the information that you're looking for. You can find it right there. Okay. So yes, Medicare.gov is separate from the SSA. What's interesting about Medicare, one of the interesting little wrinkles with Medicare, is that I hear from people all the time who haven't enrolled in Medicare yet that they called Medicare to try to find out what to do, and Medicare had no idea who they were. That's because they don't have Medicare yet. You don't sign up for Medicare through Medicare. You sign up for Medicare through Social Security, because Social Security has all the information about your work history and your eligibility. So your benefits and your eligibility is determined through Social Security. That's why you go to ssa.gov to enroll in Medicare if you are not already collecting your retirement. Once you're enrolled in Medicare, SSA doesn't have anything to do with it anymore. And that's the point at which you need to kind of transfer over to Medicare.gov to get any information you need about your Medicare benefits or coverage. So how those two work together is part of why I have job security. Okay, once you are enrolled in Medicare, your two basic building blocks of Medicare are Part A, hospital coverage. Part A covers your inpatient hospital stay, inpatient skilled nursing facility, the first 3 pints of blood, home health care. And in this case, home health care doesn't mean personal care services or caregiving services. What it means is skilled nursing care in the home. So if you had a surgery and you needed physical therapy in the home, or wound care or something like that, that is what is considered home health care under Medicare Part A. And then hospice care is also covered under Part A. Whether you opt for original Medicare or a Medicare Advantage plan, you are going to need Part A. How your Part A coverage is delivered to you is going to be different based on which type of coverage, but this is you're going to have the basic coverage either way. Most people don't pay a premium for Part A. If you've paid into the system for at least 10 years or 40 quarters, then Part A will be free. There is a deductible of $1,556 per benefit period. This is really important. You can have multiple benefit periods in a year. So, you know, when we hear about on the news about people who've gone bankrupt from medical costs and they have Medicare, it's usually, you know, this plays a role. If you have original Medicare without a supplement, you're exposed to potentially having to pay this deductible multiple times a year. A benefit period starts when you enter a hospital or skilled nursing facility, and it goes for 3 months after you're released. So if you go to the hospital and you're there for a week, and then you go home, you have to pay this $1,500 deductible. If 6 months later you're back in the hospital, you're going to have to pay it again. Okay. If you have a Medicare supplement, you're going to want to make sure you choose one that covers the Part A deductible. That way your supplement pays that and you're not exposed to those costs. If you enroll in a Medicare Advantage plan, you're going to pay their set copays, and it's not you don't have the same deductible benefit periods as with original Medicare. So if you didn't If you're not eligible for free Part A, the premium is pretty expensive. And most of the people that we work with that are in that situation, maybe they've been disabled their entire lives, or maybe they've worked in non-traditional occupations that didn't pay in. So in that case, please call us at 1-800-432-2080. We may be able to help find a way around that. Medicare Part B is the medical insurance. It covers doctor visits, outpatient surgery and supplies, your labs, x-rays, MRIs, CAT scans, durable medical equipment, which can include things like powered wheelchairs, oxygen supplies, diabetic supplies. Many other things are classified under durable medical equipment. And it also covers preventive services. Medicare offers an amazing array of preventive services that not enough people know about, including, weight loss support, smoking cessation, diabetes, self-management. There's all kinds of things that you can explore on Medicare.gov under that Using Medicare section that I showed you just a minute ago. In 2023, the standard Part B premium is $164.90. It has a deductible, a yearly deductible. This one doesn't have multiple periods. It's just once a year of $226. So if you, for example, if you had original Medicare with a supplement or a Medigap policy, your supplement will kick in and start paying your 20% once you've met that $226 deductible. Generally speaking, for Part B, you're going to have a 20% coinsurance for most covered services. Preventive services often have a zero copay. There's also a 20% coinsurance for outpatient mental health services, hospital outpatient services, and durable medical equipment. But again, if you have a supplement, the reason you enroll in it is to cover those 20% coinsurances. So when might you want to opt out or delay enrollment in Medicare Part B? There's really just a very few circumstances where you can opt out or delay enrollment without exposing yourself to a penalty. And the main one is if you are covered by your own or your spouse's active employer group health plan. The key word there is active. It cannot be a retiree plan, right? If your spouse is retired and has been carrying you on their plan and you turn 65, you need to enroll in Medicare or you will have penalties when you do enroll. If you miss your enrollment period, you'll have to wait until the general enrollment period, January through March. So you also have to double check and make sure that that plan is going to continue to be a primary after you're Medicare eligible. Many of them may not. They may go to a secondary coverage once you're Medicare eligible. COBRA is not considered active employer group health benefits. And if you think, oh, I have COBRA, I don't need to enroll in Medicare yet, you will, potentially miss your initial enrollment period and expose yourself to having to pay those penalties. And again, as I already mentioned, if you're covered under a retiree plan, it's not active employer group health benefits. It's so important to understand that many retiree plans, including TRICARE for Life, require Part B enrollment. Those plans switch over to a secondary coverage as soon as you're Medicare eligible. I actually worked with a gentleman who thought he didn't need Medicare because he had TRICARE, had a health emergency, went in to get treatment, and had to pay the entire thing out of pocket because TRICARE wouldn't pay. The way that any secondary coverage works, including a Medicare supplement, is that Medicare pays first, and then the secondary will pay the rest. If Medicare doesn't pay, the secondary won't pay either. So, the Part B late enrollment penalty. If you have waited too long or missed your enrollment in your initial enrollment period for Part B, and you delayed your enrollment without confirming that you have a special enrollment period, then you are going to be exposed to a penalty. The penalty, as I said before, is generally 10% for each 12-month period. You pay that forever. It doesn't go for a certain amount of time and then stop. So right now, with the Part B premium being $164, that would be roughly $16. So that would be an additional $16 a month that you pay on top of that $164, bringing it up to $180, if I'm doing my mental math correctly. So instead of $164, you're going to pay $180 a month for your Part B forever. So if you don't, if you can avoid a penalty, it's a really good idea to do so. You will not be exposed to a penalty if you use a special enrollment period like the ones that we outlined at the beginning of this workshop. If you're still working past age 65 and you've opted to continue under your employer's group health coverage, then when you retire or end your employer coverage, you have an 8-month special enrollment period to get yourself enrolled in Medicare. And in that case, you will not accrue penalties. I always advise people, as soon as they know their retirement date, contact Social Security, apply for Medicare A and B based on your retirement date when you know your employer insurance is going to end, and that way you don't have any gaps in coverage. Okay, so when do you not want to opt out? If you want a Medigap policy, a Medicare supplement, it is best to enroll during your initial enrollment period. Medigap policies have what's called a right of guaranteed issue period when you're first eligible for Medicare. It's the first 6 months after your Medicare begins. You have this right of guaranteed issue policy, right of guaranteed issue period. And what that means is during that time, if you apply for a Medigap policy, they pretty much have to give it to you. They cannot require you to do a health screening. They can't ask about your pre-existing conditions. If you say, I want this policy, they have to issue it to you. If you wait and try to enroll in a Medigap policy outside of your right of guaranteed issue period, say you're like, well, my health is pretty good, I don't really need this right now. And then in 3 years or 5 years or 10 years, your health has changed and you're like, wow, I have way too many copays. I think I'd be better off with a Medigap policy at this point. You're likely to either not be able to enroll in one or to really pay a lot extra, because at that point, if you don't have a right of guaranteed issue, they can require a health screening. They can decline you or charge you extra based on your age and your pre-existing condition. So if you're thinking that original Medicare with a supplement is the type of coverage for you, you're much, it's best to do it right away. If you want to enroll in a Medicare Advantage plan, you must have both Medicare Part A and Part B. If you have Part A only or Part B only, you cannot enroll in a Medicare Advantage plan. You have to have both of those building blocks in place. If you have TRICARE for life, as we've already discussed, or if your employer or retiree plan requires it, as we talked about earlier, if they require Medicare to be the first payer. Okay, so the next essential part of your coverage is a Part D prescription drug plan. If you enroll in original Medicare, you're going to enroll in a Part D plan from a third-party insurance company. If you enroll in a Medicare Advantage plan, the Part D prescription drug coverage is going to be bundled in. Part D prescription drug coverage is through private companies that sell the Medicare drug coverage. Though they vary wildly. On Medicare.gov is a plan finder. If you'll recall, when we took our little field trip a little while ago, one of the things you could do was look for plans. You can go on Medicare.gov and do the plan finder, and it will show you what plans are available in your area and how they cover the drugs you take. It's super important to make sure you know how your medications are going to be covered by the plan you select, because they are not all the same. They are all over the map, right? So it's impossible to give any kind of general information other than how they work. In order to enroll in a Part D prescription drug plan, you must have either Part A or Part B. So if you have Part A only, you can enroll in a drug plan. If you have Part B only, you can enroll in a drug plan. The plans have service areas. They each have geographic areas that they cover. They're based on their networks. So the same plan may not be available statewide. It's really important to go in to the plan finder and look and see what's available in your particular area. Just like with Medicare Part B, if you don't enroll when you're first eligible, you will accrue penalties. I've talked to any number of people who said, well, I don't take any drugs right now, so I'm not going to enroll in the drug plan. And I have to remind them that we have insurance not just for our current needs, but also because, we don't know when we're going to get hit by a bus, right? We have insurance for any needs that we may develop in the future. So it's really important to enroll in the Part D prescription drug coverage, even if you don't take any medications right now. There are lots of plans available for under $10 a month. It's not going to break the bank. If you don't enroll and you do accrue penalties, the penalty is basically, the penalty is the next slide. Every plan has a maximum deductible of $505 that's set by Medicare. Many plans have a lower deductible than that, but it can't be more than $505. The national base premium is $32.74, right? As I mentioned before, many plans are available that have a lower premium than that. And the co-pays and co-insurance for your medication is going to vary wildly depending on the medicine you take, how much, and the plan that you select. It's important to know that the Inflation Reduction Act, which passed last year in August, capped insulin costs at $35 for any insulin drug that's on your plan's formularies. So you definitely need to check and see if the drug you take, if you are diabetic, is on your plan's formulary. And if so, you shouldn't pay more than $35 a month for it. If your drug is not on your plan's formulary, they might charge you more. So it's important to check to make sure that the medicine you take is on the formulary for your plan. As I mentioned before, these plans are not all the same. You can't count on it. So if you don't enroll in a Part D plan and then you go to enroll later, you are going to have penalties. And the penalty for a Part D is 1% of the national base premium per month that you could have been enrolled and weren't. And again, you pay that forever. So say you went 2 years without having prescription drug coverage, and then you got a new health condition, suddenly you have to take medication, you enroll in a plan, you're going to be paying the premium for that plan plus $7.86 a month extra for the life of your coverage. So if you have a plan that costs $20 a month, you're going to be paying $27.86. So, you know, paying $7.86 a month when you weren't taking any medications, just to be sure that you had that coverage, would protect you from accruing those penalties. All right, Medigap policies. We're going to take another little field trip here in a second. I'm going to show you how to find the information on Medigap policies. But basically, a Medigap policy or a Medicare supplement covers your 20% if you enroll in original Medicare. Plans are identified by letters, and they're sold by private insurance companies. So I'm going to go over here. We're going to go back to the Medicare.gov website. All right. And how do you find out about this? Well, you can find out about what Medigap policies are available in your area and how much they cost by looking under the Health and Drug Plans tab. And over here is a Find a Medicare Supplement Insurance or Medigap policy. Click on that. The first place that I'd send people is to the clickable link under step 1, which is see the benefits of each plan. And it pulls up the chart that shows you the plan identifier, the plan benefits, and you can see what each plan covers. So if you enroll in a Medigap Plan A, it will cover your Part A coinsurance and hospital costs. It will not cover your Part A deductible. Remember, we talked earlier about that $1,500 plus Part A deductible per benefit period. Medigap A has an X there. It does not cover that. That would be enough for me. I would move right along. You can see all the other plans do until you get to Plan K, and it covers 50%. So what that means is it's going to cover half the deductible. You're still responsible for half. Plan K covers 75%, right? These plans are going to have a lower monthly premium, but they're also going to provide you a lower level of benefit. Okay, so if the plan has a green check mark in that field, that means yes, it covers your 20%. If it has a percent, that's the part of your 20% that it covers. And if it has an X, it doesn't cover that benefit. So I always recommend that people spend some time with this chart to make sure that they know what benefits are important to them in a supplement and how it would work for them. Then once you've narrowed in on what plan you're interested in, you can go in, you can put in your zip code, and you can see what plans are available in your area. And I'm just going to show you a quick example. Put in your age. Well, we'll pretend that we're you, Joel. And I'm going to assume you don't use tobacco. We update those prices. And it shows you the range of premiums. Now, a Plan A is a Plan A. They are all exactly the same. But look at this wide range of premiums that you might pay for the plan, right? You're getting the same exact coverage no matter which plan you choose and how much you pay for it. So the most popular plan is the Plan G. So let's look at this one. We already know the plan details from the chart, so we're just going to go and look at the policies. So you can see that there are 37 Medigap policies offered in our state, Medigap Plan G. The key thing to look at here, here's the monthly premium and the pricing structure. So one of the reasons for the difference in monthly premiums is the pricing structure. Different plans may have different ways that the premium for your plan is going to change over the life of coverage. So with attained age pricing, the premiums are low for younger buyers, but go up every year as you get older and can eventually become the most expensive. I've worked with any number of people who, are 75, 80 years old and call to say, I can't afford my policy anymore. Why does it keep going up? And it keeps going up because they have an attained age policy. And at that point, they're not going to have a right of guaranteed issue, and it's going to be very difficult and probably won't save them very much money to change. So as we scroll down, I'm only looking at the pricing structures here because I know these are all Plan Gs and they all have the exact same benefits. So I'm looking for one that has a different pricing structure. You can see they're almost all attained age pricing. So your premium may start at $116, but it's going to go up. Okay. And we scroll and scroll, and here we come to Transamerica. The premium is a little bit higher. It's $124 a month, but it's issue age pricing. It is not going to change as you get older. It starts out a little bit higher than one of the attained age policy plans, but you can count on it remaining pretty much the same with only minor adjustments for inflation and cost of living. So if you're looking at a Medigap policy, it is really critically important for the life of the policy that you look and make sure you understand the pricing structure, because that is what is going to determine how much you pay for it as you age. That's one key bit of information. And the other thing that I want to just show you real quick is just how easy it is to look at your health and drug plans. So if you go, again, we're on Medicare.gov, you go to Find Health and Drug Plans, Find Plans Now. You put in your zip code, and I'm here in Santa Fe, so I'm just going to put in 87505. Let's say you're looking for a prescription drug plan. You can also search for Medicare Advantage plan. Let's say you're not getting any assistance. You always want to put in your drug costs when you compare plans. And I'll just enter a couple of really common ones. I'm going to enter a blood pressure medication. I'm just going to use the default. Let's add a metformin, an insulin drug, a diabetic drug. Okay, and let's just do that for now. You always want to put in pharmacies because the prices that you pay are based on the networks and the relationship that the plan you choose has with particular pharmacies. So I'm going to put in mail order, Walgreens, Smith's, Albertsons, and you can change. Right now it's set at a distance of 1 mile. You can change this to see capture a larger selection. So let's add CVS 2 and then click on done, adding drugs. And we can see that there are 24 drug plans available in this area. They're arranged by the lowest drug and premium cost. The first one that shows up is this WellCare value script. It has an $11 a month premium. If we enrolled in this plan for the rest of this year, basically we're going to be getting our drugs for free. I'll show you how I know that. We go under plan details, right? This one has the $505 deductible, the maximum deductible. All of the pharmacies are preferred in network pharmacies. So no matter where I went to get those two particular medications, I would have a zero copay. So the only cost for me for having this particular plan, if I'm taking those medications, is the monthly premium. The plan's going to cover 100% of those drugs. This is a pretty good plan. So you can go through and you can search the plans. We can see that the next one, the Cigna RX Saver, if we pick up our medication at a retail pharmacy, we're going to have a copay. We're going to pay more, right? So with those particular medication, WellCare seems pretty cost effective. Under this plan, the Cigna, if we go scroll down, we can see that Smith's is out of network. You wouldn't want to get your drugs there because you'd be paying full price. Albertsons, Walgreens, and mail order are preferred. So those are going to have the lowest costs. But you do have, for the metformin, you do have a copay, right? So if you take these, remember I told you before, these plans are not all the same. You can't assume that your drug is going to be covered the same way plan to plan. We can see already that there's a big difference in how the glipizide metformin is covered between just the first two plans on our list. So you can go in here, you can get all the information you need to make an informed decision from Medicare.gov. You can also call us. This is one of the services that we provide at the SHIP program, and we would be more than happy to help you go through your options. For people who are eligible for the Retiree Health Care Authority, I am going to share that. Let's see. I'm going to show you where to go to get that information. The Retiree Health Care Authority contracts directly with insurance companies to negotiate special plans for their members. And they have a monthly seminar, which I always forget where to find it, but it's here on the New Mexico Retiree Health Care Authority website. It's nmrhca.org. If you go here, let's see. Is it under switch and open? Or I don't think it's under switch and open enrollment. Anyway, wander around on here. This is for open enrollment in the fall. Wander around on here and you will find they have a month, like I say, a monthly seminar, and you can find out about the plans that they offer through the Retiree Health Care Authority. These are plans that are not available generally to people who are enrolled in Medicare. They're only available to Retiree Health Care Authority members. Do you have any questions about that before we move on to the next section? Okie dokie. All right, we've pretty much already gone over this on the actual website. This is just kind of an example of what that chart looks like and some other information that you can find on Medicare.gov about how to compare the Medigap policies. All right, and the next way that you may get your Medicare coverage is through a Part C or a Medicare Advantage plan. Medicare Advantage plans are not a separate Medicare benefit. They are your Medicare. They're just a different way to receive your Medicare benefits. They're run by private insurance companies that contract with Medicare. Most of the Advantage plans include Part A, Part B, those are required, and Part D, but not all of the Advantage plans include a Part D prescription drug plan. So you have to kind of pay attention and make sure you understand what the plan that you're considering includes. Sorry. As we mentioned before, you have to have both Part A and Part B, and you have to live in the geographical area that plan covers. There are now a few Medicare Advantage plans that cover people who have end-stage renal disease, but generally speaking, original Medicare with dialysis, original Medicare is just a better bet. Costs of a Medicare Advantage plan are all over the map. The deductibles vary. They cannot be higher than $226, which is the Medicare Part B deductible. They can't be higher than that, but they may be less than that. Many of the plans have no deductible at all. The premium, again, all over the map. I've seen everything from a zero additional premium up to $200. Co-pays and co-insurances also vary by the plan. If you enroll in a Medicare Advantage plan and it doesn't work out for you, you do all your research, you pick one that you think is going to be great, and then it turns out you just don't like it, you always have the opportunity to change plans during Medicare Fall Open Enrollment. Fall Open Enrollment is every year from October 15th to December 7th, and that's the opportunity to change your prescription drug plan or your Medicare Advantage plan. If you're enrolled in a retiree organization like the Retiree Healthcare Authority, they have a switch enrollment period in the fall as well. It overlaps with Medicare Open Enrollment, but it isn't the same. But you'll get information about that from them. How do the Medicare Advantage plans work? Well, it depends on which type you enroll in. Most of the plans here in New Mexico are either HMOs or PPOs. We do have a few private fee-for-service plans and Medicare savings accounts, but they're not widely available and they're not widely used either. By far, most of the plans that we have are HMOs or PPOs. A special needs plan is something that you're going to need to qualify for either financially by qualifying for Medicaid in addition to Medicare, or based on your health conditions. If you have not received a Medicare and U book, most people receive them in the mail, you can also download it on Medicare.gov. It's available there. You can call us at 1-800-432-2080 and we can mail you one if you need one as well that has the New Mexico specific information in it. One last really important thing that we need to cover is how Medicare works with Medicaid. For some people, going on Medicare is a cost savings if their employer health insurance cost more than the Medicare premiums. But for other people, it is quite a financial hit. If you're low income, if you had Medicaid, if you were on Medicaid before you started Medicare, or you're on you're at 150% of the federal poverty level or less, you're probably going to qualify for one of the Medicare savings programs, which is a Medicaid benefit that's designed to help make Medicare affordable for people on limited income. It is easy to apply online at Yes New Mexico. That's the state Medicaid website. It's www.yes.state.nm.us. That's another thing that we help people with. If you don't have a computer or you're not confident with that, you can call us and we can help you apply online over the phone. The other main Medicaid benefits that coordinate with Medicare are the home and community-based waiver, which is a full Medicaid benefit for people who need in-home caregiving services. It's designed to help people stay in their homes and not have to go into a skilled nursing facility. There's lots of people out there who are not safe and healthy in their homes without assistance, but with a little assistance may be able to age in place. That's where the home and community-based waiver comes in. The only way to apply for it is by calling the Aging and Disability Resource Center, or ADRC, at 1-800-432-2080. You cannot apply for this benefit directly from Medicaid. You have to go through the ADRC. The other benefit is the institutional care waiver, and this is for people who are in a skilled nursing facility or rehab and who have run out of funds to pay for it. The institutional care waiver you can apply for directly from Medicaid. You can apply for it on that Yes New Mexico website, but usually the social services coordinator or social worker at the facility will help the people apply for that. Okay, I mentioned the ADRC. That stands for Aging and Disability Resource Center. It is the call center for the state of New Mexico. When you call the ADRC, you're going to reach an options counselor that's going to ask you what you're needing, what resources you're looking for, what help you're needing. And they are going to connect you with the resources to meet your need in your local area. They also can get people registered for that home and community-based waiver that I just told you about. They can connect you with a wide variety of local, state, federal, public, and private resources to meet whatever need you're having through our network of care. We offer short-term assistance for people who have an immediate, urgent need. We help people with housing, with transportation, with all kinds of things. We help with applications if people need help with that. This is where you reach the SHIP program if you have questions or need assistance with Medicare issues, whether it's finding a Medicare plan, understanding how your benefit works, filing an appeal, anything like that. If you think that you may have been the target or the victim of a scam or fraud, this is the same way that you connect our Senior Medicare Patrol that we discussed at the beginning of this workshop. You can also reach our prescription drug assistance program through the ADRC. And it's that same, all of these services are available through that same one phone number, 1-800-432-2080. You can also reach us on our website, www.nmaging. We have live web chat. This is staffed by a real person. It's not an AI, and she's right here in our office. I always like to give a little plug for the Affordable Connectivity Program. Oops. This is a way for low-income people to get access to broadband. Okay, basically, if you qualify for Medicaid, you're also going to qualify for this Affordable Connectivity Program. And too many people don't know about it. And since this really is such an essential way to stay connected in our world these days, I like to give a little plug. I mentioned Yes New Mexico when I was talking about Medicaid. This is what the website looks like when you go to it and you create an account. You can go in, you can apply for benefits, you can check the status of your applications. It's a great resource. Okay, that was a lot of information. Medicare 101 is a really intense data dump. So if you have questions, I'm happy to answer them now. You can also, digest everything that you've just heard. And if you have questions later, you can call us at 1-800-432-2080 or go online to our website at www.nmaging and give your question to one of our web chat agents, and we'll be happy to help. I am not seeing any messages in the chat and nobody's unmuted. So again, I am Chris Winterode. This is my email address. You're welcome to email me with questions. You can reach our SHIP program again at that 1-800-432-2080 number. We will put you in contact with somebody who can answer your questions. Our YouTube channel that we took a little field trip to, you can also just go to YouTube and type in the New Mexico Aging and Long-Term Services Department and you'll find us. We're also on Facebook and Instagram. If you want to follow, we're constantly posting new things and information about upcoming events. If you would like to do a survey, I would be, I'll put that information in the chat to make it a little bit more accessible, but it is surveymonkey.com/r/ACLED. Be happy to get your feedback. Okie dokie. So that was a lot. Thank you for sticking through to the end. If you have more questions, you're welcome to give us a call. You know how to contact us. And thank you for spending this time with us today.